Okay, I think what I have to do is I have to make you panelists. So let me take a look how I do that. 1 minute. There we go. I want to add panelists. Here we go. So I'm promoting John to a panelist, and then I'm promoting Lynn to a panelist. Okay, I think you maybe both have to accept. There's John. Yahoo! We did it.
Hello.
All right. Awesome.
All right. Look at that. Look at us.
Fancy,
All
fancy. All right.
Yes, indeed. So I guess we probably just better jump in here, right? John, I'll turn it over to you to get started.
Okay, we are recording, correct?
We are recording, yes.
Okay, wonderful. All right, then let me kick off.
Okay.
Welcome, everyone. Welcome to our panel on why you should invest in young adult mental health care. I'm your moderator, John McPhee. I am the CEO of the GED Foundation, which is a nonprofit that focuses on protecting emotional health and preventing suicide for teens and young adults. Our guests today are Lynn Morris, CEO of GDBHT, and Dr. Nora Feldpausch, Medical Director of Mantra Health. Lynn and Nora, I'd like to ask you to introduce yourselves. Lynn?
Sure. Hi, everyone. My name is Lynn Morris, and I am the CEO of GDBHT Mental Health Services, where for over 80 years, we've been scaling suicide prevention and mental health care across California and beyond. We are also the home of the first and most comprehensive suicide prevention center in the nation.
And I am Dr. Nora Feldpausch. I am a psychiatrist that works as the medical director of Mantra Health, which is a telehealth company that specializes in partnering with universities and colleges to bring healthcare, mental health care to students nationwide. We have both psychiatric providers and therapists, and we are really trying to build the quality, evidence-based, informed network of providers that work together to bring high quality telehealth to students.
Terrific. Lynn and Nora, I'm excited to talk to you today. Lynn, let's start with you. Why should we prioritize the health and well-being of young adults versus other populations?
Yeah, that's a great question, and so important because mental health care right now in particular is a public health issue for young adults. And 75%, not only do 75% of lifetime mental health disorders develop by the age of 24, but nearly half of all college-age students are experiencing depression, anxiety, or both conditions. Suicide is the second leading cause of death between people 10 to 24 years old. And it's really important that we're addressing this problem because we have a chance to do something here. We have a chance to really acknowledge how important prevention is in talking about mental health and talking about mental health as health. So we should feel no shame in talking about mental health just as we do about talking about our physical health, and getting young people more acclimated to addressing those issues, talking about them, feeling comfortable, reaching out and seeking help will hopefully reduce the symptoms that they're feeling and get them the help that they need to avoid any crisis situations in the future.
Mm-hmm. Yeah, I absolutely agree with you, Lynn. And then I would just add that this is the age group when the majority of the more severe mental illnesses start to present themselves. So bipolar disorder, schizophrenia, this is the age group when you start to see these disorders develop. And we know from the data that identifying these disorders early and treating them effectively has a huge impact on outcomes. It has a huge impact on suicidality, and it has an impact of lifelong adult function. I think the other thing is that this is an age group where they're starting to become independent and they're starting to think for themselves, but they still have not had such an interaction with the mental health system or really with the world yet to have cemented the way they think about and approach things. So I think we really do have an opportunity, unique opportunity, to address their mindset, to train them how to navigate the mental health world, to train them how to think about and monitor their own well-being in a way that you don't necessarily have in younger kids or in older adults.
Yeah, thank you both. I mean, the need is just so great. And the data show actually that from the moment symptoms first emerge in those disorders, Nora, that you just described, it can take 8 to 10 years to have an accurate diagnosis.
Mhm.
Um, so we can clearly do better. Now, knowing the stressors young adults face in emerging mental illness clearly is one, but there's also academic pressures in balancing college and personal commitments, adjusting to independent living, concerns about the climate, war, school shootings. There's just so much. And even when a young person does seek mental health care, it's not always available. It'd be great if you both could talk about how your organizations are working to change that. And Nora, if we could start with you.
Yeah, absolutely. So I think, there's a couple of things is that we want to have kids get access to care, right? And that access traditionally has looked like I need to walk into a counseling center on the ground, or I need to find a clinician on the ground who can see me. And we know that counseling centers are desperately trying to staff up, but are not able to keep up with the demand over time. And we also know that access to care within, especially rural communities, but really across the United States, is very hard to come by, and it's expensive. You have to try to figure out how to fund it, how to identify it. So what we're doing is we're not only bringing telehealth so that we can have providers who have expertise in this area, providers who have diverse backgrounds, providers who specialize in working with populations that suffer the most from things like suicidality, mental illness, and stress, our students of color, LGBTQ plus students. We can pool those providers by bringing them as a group together to a university that might not be able to hire them on their own, or might not be able to recruit them on their own. But the providers that you have access to are only as good as the quality that you can provide. So we really think very deeply about creating quality, thinking about how do you identify, recruit, and maintain providers who are experts in this area, because this transitional age, this college mental health, is a developmental stage that's different from other aspects of mental health. And so we are not only bringing that quality together, building protocols that we can use to really set a standard of care, but also improving access. So students can access people after hours, they can access people without having to actually walk into a counseling center. So you decrease some of the stigma that they have to experience. And they can access potentially providers who look like them or have a background similar to them, which is very hard to do if you're just dealing with 1 or 2 or 3 providers that are recruited and paid for specifically by universities or colleges on the ground.
Yeah. And Lynn, yeah, how is DD Hirsch addressing the access to care challenges?
So the DD Hirsch Crisis Line, we serve over 137,000 people a year who are in suicidal distress, or someone who's concerned about someone in suicidal distress. It's available 24/7. We have bilingual counselors on the line as well and can take any language. Our crisis line is accredited through the American Association of Suicidology, and we serve all ages, all ethnicities, all backgrounds. But we do find that young adults use the phone line. About 45% of our calls are from young adults, but chat and text, making those services accessible to young students and young people, is critical, because I know on our chat services, about 85% of our chatters are young adults, and on text, it's 90%. So it's very high. So having different modes of communication and ways to reach out for help for young students is especially critical when they are in college, because, for example, they may be in their dorm room or their apartment. They might not be able to have the access to get on a phone and talk confidentially to one of our counselors if they're in crisis. This way, if they're able to chat or text, they're able to sit, they could be right next to somebody and still reaching out for help and getting the support that they need. So having those modes of communication is extremely important. Also, we do a lot of training and education and awareness building at DD Hirsch. So that's important too, because the more people are aware of what symptoms of suicidality can look like, warning signs, they can understand what those are. They can reach out, because in this population, especially with young adults, they reach out to each other, not necessarily, other parents or, other support folks in their life. They usually reach out to each other. So we do a lot of training and education of what to look for, how to identify those warning signs, making sure that they know what to say in that crisis and that they don't have to have all the answers. They just need to be human. They need to connect with that person and then have a resource like the Didi Hirsch crisis line to be able to continue to help that person in crisis and get them linked to the care that they need.
Mhm.
Yeah, thank you so much for that. We talk a lot at the JED Foundation about that very point, that you really need to just trust your instincts if you're concerned about somebody else, and then lean in and initiate that conversation with them about it. Let's zoom in on higher education and college students a little bit more. So imagining behavioral healthcare providers that are serving college students, or leaders of mental health services in higher education. If they want to augment their services on campus with digital or telemental health services for the very reasons, Nora, that you described earlier, in terms of the benefits they can bring, how should they be thinking about evaluating the quality and the evidence behind these services, right? So that they know they're bringing high quality services to their students.
Mhm. I think this is a really good and a really important question, because when you partner with a third-party telehealth company, even though they're taking responsibility for seeing the students, the university actually is seen by the students who access that, by the parents, by the staff, as represented by that relationship. So you really do want to make sure that you're looking at how quality has been built. One of the ways that we think about it at Mantra specifically is, first of all, we started out by bringing together experts in college mental health to build our program. So we didn't tap general physicians or anything like that. We tapped folks who have spent years developing college mental health protocols and running college mental health centers. So we really have a deep understanding of what this population needs and what the response and the care needs to look like. You really want to make sure that when you're working with or vetting a telehealth company, that they prioritize standard of care and that they have protocols around standard of care. And ask them, how do you approach this population? How do you create protocols to make sure that all of your providers are excellent in their work? How much time do you allow providers to have? For example, we block an hour for intakes, 30 minutes for follow-ups. We really make sure that the time is there to do this kind of quality work, and then ask, where are you recruiting your clinicians from? Are they people who specialize in working with this population? How do you make sure that they're up to date on their training? How do you make sure that they have the collaboration that they need? Because some of these students can be pretty complicated when they present, and really trying to manage that in a vacuum as a clinician who happens to be in telehealth but doesn't necessarily have the support structure that they need. I think the last thing that we really look at, well, two more things really: risk and risk management. How do they handle risk? And if they have a person who escalates or becomes imminently risky, do they have protocols around how they handle that? And can they uniquely tie that to your university's resources? And then, are they going to be transparent about outcomes? Can you see who is using this service, and are they getting better? And is this service delivering the care that they say that they can? And one of the things that's incredibly important, I think, in all mental health, but specifically working with college students, is collaboration. And I would ask them, how do your providers collaborate with us, with our providers on the ground? How does our administration collaborate so that we know if a student is escalating, or we know if a student is referred out of care? That highest risk period often is when the student is referred out of care but hasn't gotten into a new setting of care. How do you monitor that? How do you track that? And how do we as a university know if we need to also have eyes on or be providing more support? And then, so you don't want to be referring into a company that's a black box. You really want to have a company that partners with you and that will answer your questions about quality of care and continuity of care and risk management, and collaboration. Have a clear way that collaboration can happen quickly and effectively among the different parties that are involved.
Yeah, and I think for the Didi Hirsch crisis line as an adjunctive services a service to the mantra health, telehealth, and psychiatry, it's important to have a 24/7 crisis line attached because there are hours of the day where providers are not available, whether on campus or through Mantra Health. And that's where the D.D. Hirsch crisis line comes into play for students who are at high risk or just need somebody to talk to at 2 a.m. or, whatever time it is, we will be there. And I think the quality is important because there are a lot of providers in this space right now that are not well trained. They're not using evidence-based practices. And that's where D.D. Hirsch really highlights that and makes that a priority. So as part of the National Suicide Prevention Lifeline, we use evidence-based practices on the line. Our counselors go through over 100 hours of training before they even can answer a call. And we want to make sure that people know that because we want people to feel comfortable in calling, that when they are in a crisis, we can handle anything. So whether it's somebody who's having a relationship issue, whether it's somebody who is in imminent risk, you also want to look at providers for crisis lines that are able to do more than just answer the call or the chat or the text. Somebody who recognizes the need of somebody who may be at high risk, but not in need of emergency rescue, because that's always our last option. We want to make sure we can de-escalate people first that are in crisis. And then if we're able to do that, we can offer follow-up phone calls. So that's something where you offer a call to a student that you may say, hey, let me call you back in an hour or in a month or in a week or a couple of days to check in on you to see how you're doing. And then we reassess risk, we reassess their safety planning, making sure they're getting linked to resources. So that additional support that we provide is unique to D.D. Hirsch in a lot of ways. And it's important as far as quality to make sure that students aren't, like Dr. Nora said, just calling into a black box, but they're actually getting the quality care that they need in that moment, because we are dealing with life or death at this situation.
Absolutely. Absolutely. 13% of college age students have considered suicide in the last year. And so we're talking about and we're talking about astronomical numbers, right? Second leading cause of death in this population. So you really do need someone who understands and knows what they're doing. This is not something where you can just, speaking to Lynn's point about the in-depth trainings and the collaboration and the oversight and the following up and following standard of care. When you partner with someone, you really need to be able to make sure that that is all happening and in place. And they need to be transparent about how that training is happening and showing you over time that this is indeed the quality of care that they're offering.
Yeah, and then last point on that is making sure that you're able to get some data. So, if a crisis line or Mantra Health able to provide data about the students, you're going to be able to recognize trends and things that are happening on campus that you can address more proactively than you would have otherwise if you didn't have that data. So that's important as well.
That's exactly true. And we've created a dashboard where administrators and clinicians can look how many students are being seen, what are they being seen for, what's the trend, how many are high risk, what's happening with those who are high risk. You really, it enables the collaboration and the partnership, enables you to work together on what's going on. I know it can be tempting to sort of just get them referred out, just, paperhead and just let somebody take care of them. But ultimately, when you're talking about saving lives and you're talking about how that reflects back on your university or your college, having that quality in place is essential, because there really is a big difference between someone who's been specifically trained in this area and someone who may be licensed and may have some experience in other areas, but doesn't know how to work with this population and specifically with the risk level of this population.
Yeah, so as you talk about the benefits of supporting college students in this way and the importance of data, right, which is critical, how should we think about return on investment, right? So if schools, right, are investing in the mental health of their students, of these young adults, how should we be thinking about the return on that investment? And Nora, why don't we start with you?
Yeah, absolutely. So, it goes without saying that if somebody loses their life, there's no way to summarize how much that cost actually is. But if you're really just going to look at the nuts and bolts and the economics of it, the first thing you have to realize is that a mental health or a mental illness impacts a broad number of people on campus. It doesn't just impact that individual student. If that student is not in care, doesn't get adequate care, it impacts their roommates, it impacts their suite mates, it impacts their dorm, it impacts their professors and the larger community as well. So when you're treating one student, you have to think about that in terms of the ripple effect that you're actually treating and supporting a whole community of people. When you just look at the numbers, Healthy Minds has done a study on the value of a campus counseling center. 30% of students who have depression will drop out. And so if you avert 30 dropouts for every 500 students. So if you provide access to care for 500 students, you can save 30 dropouts, which is $1.2 million in tuition and $3 million in lifetime earnings per student. So there really is a long-term cost of not investing early on in high quality care.
Yeah, and I think even beyond the economic concern, the return on investment of the mental health of the students overall. So I know on our D.D. Hirsch crisis line, 95% of the people that we talk to were able to de-escalate, where they don't need emergency response. They don't need to have to go through that traumatic, experience and very expensive of calling out, law enforcement or others are going to, the hospital. So the return on the investment is there, obviously economically and also on a broader scale for the mental health of the students.
Yeah, absolutely. We hear from students all the time and faculty who say that they're way overburdened by having to manage mental health crises without having the training that they need to do that. So having something like D.D. Hirsch, having Mantra, well-trained providers to be able to take that burden off the faculty and other students, you're going to see their ability to achieve and their willingness to stay and work for your university or to attend your university going up as well.
Terrific. Well, thank you both. This is a conversation that could go on for quite a while. We're coming to the end of our time, but thematically, college students and young adults are in a period of time where it's just critical that we help support their mental health, and we notice and identify those that might have an emerging mental illness or be in distress. And colleges provide a real life system of policies, programs, systems, services, right, that can be knitted together into a mental health safety net to do just that, to help prevent, as Lynn said, by increasing protective factors and setting up the systems to notice who needs help and get them help. And there are now effective telemental health and digital services that can augment what schools are doing and really help them in this mission with multiple positive returns, as we've discussed. So thank you to you both for this discussion, and thanks to those that have tuned in to listen to it.
Thank you.
Yeah, thank you.
Okay, I don't know how to stop it. All right.